Stay-at-home orders for people that are not essential personnel, that's starting to open up now, but there are concerns about people's safety. People are concerned about what to do and what not to do, whether they're going to take advantage of things being open. With regard to our children, children are out of school. This has been a drastic change. Parents have to balance their work life and children's education if they're working from home. Or if they need to work outside of the home, they have to figure out how their children are going to get taken care of. In addition to that, parents are now prized with having to provide children's education, right? So teachers may be doing some virtual teaching, but a lot of times I've heard from parents that teachers are sending home assignments that children have to complete, and who else to help them with that other than their parents, right? Children don't have in-person socialization with their peers, and we wonder about the impact of this and whether there's short or long-term impact. Children don't get to interact with their teachers in person, or their school counselors, or the administrators. They don't get to participate in community sports, after-school activities, and physical fitness. And the biggest thing is we don't know when the end is in sight. We don't know when this is going to end. We don't know if schools are going to reopen in the fall yet. And if they do, what that's going to look like. We've heard various things about masks and other types of things, social distancing, but we have no idea what this is even going to come down to. So it's hard enough to question, can we survive this? And how are we going to survive this? And what will the impact be of this, short and long term? 55 million students in the US are out of school. 70% say that their child is in an online distance learning program run by their school. 42% of parents are concerned about the negative impact that this is having on their child's education. And 27% say that the school year should be extended into the summer and feel that we shouldn't be ending at the end of June as we normally do. 58% of people, when they were surveyed at the beginning of May, thought that or expressed concern that their schools won't reopen in the fall. So what does this all mean? This means that parents have to balance work and child care and children's education, right? Essentially, parents are becoming in-home school instructors, or if they don't do that, learning for children stops. And either one, it has significant implications. We know that during the summer, there's a huge amount of learning that's lost. And if this is extended beyond the summer time, it could even result in more knowledge loss. So what could we do about it? How can we facilitate? How can we improve the outcomes that children might have? Well, one is providing structure. Regular bedtimes, regular wake-up times, getting children dressed in the morning, regular meal times, setting an educational schedule with breaks, because kids learn well when they have breaks in place, when they're not just going right through. So if they're in middle school, right, they're going from one class to another, and while that might not be a big break, that little break of movement is really important for their education. Creating an environment that's really conducive for learning. So an area of the house and somewhere where there's a lack of distraction that's kind of separate from other areas where they would maybe play, if that's possible, right? Not everybody has that ability to do that. And then, everything's being done online, and, we've heard contrasting things about whether, certain online activities are okay, other online activities might not be okay. Limit your children's online activities. Well, that's really hard to do right now, right? When education's online and social interactions are online and everything's online. So it's important to also limit online time and make clear distinctions between free time and educational time. So even though they might both be online, it's important to make those clear distinctions. So it's not just online time, it's education time right now, and it's play time now. Integrate physical activity in the child's day. Make sure that the child has some movement of some type throughout the day. That's really important and very helpful for them learning. And utilize online educational resources, right? Teachers and schools have resources online. There are tutors online. There's school counselors online. There's speech therapy. I just presented with a speech therapist the other day who provides speech therapy online. Occupational therapy is still available, and also mental health services like the services that I provide. I'm doing it online right now, so we can do it in a safe way. As things open up, obviously in-person services will become available again. But even right now, where there may be limited in-person services, they're still available. It's just, you have to seek them out and know that different providers are providing those services just via an online technology. Make sure to continue social contact. And this might be small groups of children, maybe one or two if you feel safe, in person. But at least online, it's really important. So even though we've said in the past, historically, limit online activities, this is an area that you want to make sure that you don't give up. Children need to have social interaction, and even if that is at this point online. And summer learning can be very important. So even if schools close, it's important for parents to facilitate children's development and learning development throughout the summer. It's important not to just lose that time. We know that, as I mentioned, that summer often results in a learning gap, but especially this year where we've had months of no in-person school, and most likely children haven't been learning as much as they would when they were in school. So it's important to extend that in your own way if schools are not extending it, which does not appear that they are. Also, educating your kids about COVID. We don't know what the impact of COVID-19 is going to be on the psychological functioning of children and adolescents. So it's really important to talk to your kids. But you might wonder, well, how do I do this? What do I say to them? What don't I say? What do I say? I don't want to scare them. The most important thing when having difficult conversations with kids is asking them what they know and what they think, and then filling in the gaps. Right? You don't need to have all the answers. You don't need to know, what exactly you want to say or don't want to say to your kid, which makes it a little bit harder because you don't know all the things that your child might ask, but it's really important to assess what they know. And if they ask questions that you're not sure how to answer, just tell them that you need some time to figure out, you need to find out the answers for them, and you'll come back and actually come back with some answers that can be helpful to them. And I just urge that people not lie to their kids. You don't have to tell your kids every detail of everything that might scare them, but it's really important also not to misrepresent, because they're going to get that information from somewhere else, and then your credibility goes down the drain. So that's really important that they know that they can come to you for honest answers. The other thing that we're very concerned about, and we're not sure the impact of, is school-related anxiety and school phobia. It might be great right now for kids that have school phobia and, they get to not go to school and no one's pushing them to go and that kind of thing. However, the longer they don't go and the longer they're able to not go to that environment, the harder it may be for them to return. So if school does open up in the fall, they may need extra assistance with that. And it's never too early to begin that, right? So if your child has been prone to school phobia, school anxiety, it's important to get help now rather than wait until the fall when the problems escalate. And, I can't emphasize enough, have fun. It's really important to have a good time. You have your kids at home. This is a gift, right? So you normally don't get to spend this much time with your children. They're at school. They might be really busy with after school activities and other types of things. And now you get all of that time together. And that could be overwhelming in some ways, but also could be really great. And you can find new activities and new things to do with your kids and just have a really fun time together. And the bonding that can happen during this time is like no other that we've ever experienced. The other piece of this is it's important to seek help when you or your children need it. So if you're feeling you're at your wit's end and you can't handle things, it's really important for you to get some help. If your kids are struggling, it's important for them to get help. And as I mentioned, mental health and telehealth and telepsychology is available. And research shows that it's as effective as in-person therapy. You might be surprised by that, but it is. For young kids, it may be a little bit harder, but I tend to spend a lot more time with parents in that case. With older kids, it's as effective as adults. So how do you know when to seek professional assistance versus doing some of these strategies that I mentioned on your own? Well, if you see that your child has persistent sadness or irritability, frequent stress or worry, a decline in their occupational or academic performance, difficulties with their social or intimate relationships, difficulty sitting still or focusing or concentrating, loss of interest in activities that they previously enjoyed, or maybe some of those activities that they previously enjoyed they can't do, but they're not finding any alternatives, like they're just not interested in pleasurable activities. They talk about physical complaints and there's no medical explanation for them. If they have sleep difficulties, an increase in sleep or decrease in sleep, or changes in their eating, significant increase or decrease in their eating. Those are good signs, good indications that professional help may be necessary. Professional help is definitely necessary if they're talking about harming themselves or someone else, if their safety is at risk, and for immediate concerns, it's really important to call 911 or bring them to the local emergency room. If they're less imminent, you can reach out to a mental health professional who can provide some assistance. So I'm going to turn over to Dr. Liz Matheis right now, and she's going to share some things with you about psychological testing and advocating for your kids academically.
Thank you. So I'm a mom of three. I have a 14-year-old, an 11-year-old, and a 7-year-old. And being a teacher now, adding that to my resume, now that I'm a teacher, I can definitely see and have a very strong sense of my children's strengths and weaknesses, which I think we all kind of knew before, but I think things have really changed because now we're sitting there and providing a lot of the instruction. I've heard from parents who've reached out to me professionally and even personally that things that they once said, well, I don't see that at home. And teachers would say, this is what I'm seeing in the classroom. I don't see that at home. We're now seeing it. We're absolutely seeing it. I know for me, it took us about 6 weeks for me and my 7-year-old to find a groove to get the work done. And every day was a battle. It was really hard. I was devastated when school was called off for the rest of the year. To say the very least, I really disliked the battles that we were having. Part of it was because there are certain things that are hard for my child. It's hard for him to read. It's hard for him to write, which I knew, but I really understand the extent of it. And so tonight, what I'd like to talk to you about is what are the signs to look for as you're homeschooling your children, and then what do you do with that information? How do you return back to the school to be able to share that information to get the supports that you need? And so I'm going to discuss the different types of support plans that are available. And they, as a former school, well, not a former, I'm still a school psychologist, but as a school psychologist, and I worked on the child study team, I'm very familiar with the IEP. I'm very familiar with how to determine eligibility. And now I provide the testing privately that parents do take back to the child study teams or take back to the school. They use these reports in very different ways to determine strengths and weaknesses, to figure out, if it's an older child like an adolescent or a young adult, they're able to take that information and figure out, how do I help my child study? How do I help my child read and write, given their learning profile? So some things to look for. I'm going to start off at the kindergarten level for people with young children. At the kindergarten level, you are likely seeing that your child is still having a hard time identifying letters, whether they're lowercase or capital, and consistently. Most importantly, it's consistently. So a child may have mastered the letter B or C today, and then when it's presented a few days later, the letter looks novel. They don't remember how to form the letter. They don't remember they don't remember what letter it is, or they don't remember the sound that it makes. So inconsistently identifying the letter and its sound. Difficulty with identifying numbers. Struggling still to rhyme, to identify rhyming words and rhyming sounds. By the end of kindergarten, at this point in time, our children in kindergarten should have a pretty decent sight word vocabulary, meaning they can identify simple sight words. So if your child has a small sight vocabulary, words that they can identify consistently, and or of, but, words like that, this is a sign of difficulty. For in kindergarten, children who are avoiding writing tasks, who don't want to hold a pencil and write because it hurts or they don't know how to form the letter. Some parents have reached out and said, I can't get over how my child is truly struggling to sit still. And once they're falling off their seat, they need a snack, they're jumping up and down. When they finally sit down, their attention span is actually very short. And they're not able to get through a lot of work. Or they're impulsive. They think about a toy they want, they get up and they run off their seat. Or just difficulty following two-step directions of, take this worksheet and work on number 2 and 3. Or go on to this app and open up the book that your teacher assigned to you. So these are the kinds of things to look for in kindergarten. And key thing being consistency. If you're not seeing your child consistently being able to identify letters, sounds, rhyming words, numbers, sight word vocabulary, in addition to maybe just a lot of meltdowns and frustration, limited attention span, things to look for. First grade, the child has mastered certain sight words, but then over time forgets them. Or the sight word vocabulary is very much smaller than would be expected in comparison to your child's peers. Or your child is reading at a grade level, at a reading level, and I know a lot of schools use the Fontes and Pinnell reading levels. The reading levels, your child is functioning at a lower reading level. So for example, my son was reading at the beginning of a first grade level in March. So that put him behind for a bit. And so that's something that I was aware of and wanted to see how he was going to continue to progress. Again, if your child is avoiding writing tasks, really doesn't want to hold the pencil, doesn't want to or can't really form a sentence, or, let me dictate to you and you write the thought down. And I'm not talking about big sentences, very small sentences, or being able to generate a sentence and write it down. Remembering to capitalize, and again, consistently. Difficulty identifying which is a smaller number and which is the larger number by first grade. Having, again, a short attention span, struggling to sit long enough to finish work, is impulsive. The other thing is having a hard time remembering, having a poor memory, is a sign that something is off. Word problems are difficult, and I know it's crazy to think that first graders have word problems, but they do, and they're simple, but nonetheless they're usually 2 to 3 step problems that they have to read and translate and then manipulate the numbers. Again, difficulty following 2 to 3 step directions, or becoming so tearful and having meltdowns about schoolwork that it just becomes this big battle. Okay, going into second grade. So your child is now reversing numbers and letters. And even if you saw this in kindergarten and first grade, it's still developmentally appropriate up until the end of first grade. So by second grade, we should start to see the letter and number reversals begin to slow down. The B's and the D's, C's, U's, M's, all of those letters being reversed, or writing numbers backwards, that kind of thing. Then in second grade, now your child doesn't understand what he has read or what has been read to him or her, or struggling to read fluently, struggling to break down words and sound them out. Again, having a short attention span and being impulsive, and difficulty following those multi-step directions. And schoolwork still being a very big, this is now week 15 for us, and yes, the school year is coming to an end, but over time, if it's still a battle, then that's a pretty strong sign for you as a parent that if the attention span is short, they're impulsive, they're tearful, they're having meltdowns, they're ripping up paper, throwing things. That's a sign that school's hard. So in third grade and up, so a lot of these skills now will represent third grade and up, is that your child is struggling to organize his thoughts and write them down. That he or she have ideas that they can share with you verbally, no problem. But when it comes time to write it, that's a really tough thing to do, where they lose their thoughts or they write minimally. And a lot of times kids are labeled they're lazy or they're not putting in enough effort. But it could be a function of they need to depict, excuse me, I can't push out this word, depict their thoughts visually, or their attention is fleeting and they're not able to hold the thoughts in their head long enough in order to get them down on paper. By third grade and up, if your child's handwriting is still very large and letters are poorly formed and writing is very labored and avoided, I've tested many children where I put a pencil, hand them a pencil to write even just the letters of the alphabet or to write a sentence, and they look at me and they're like, I don't want to do this. And, that's a sign to me, because most kids can take a pencil and write something. I'm not asking them to write novels, but just to be able to write. Difficulty still breaking down sounds, words, breaking them down into the sounds and then putting them together, and following multi-step instructions. Because at this point in time, by third grade, children are no longer necessarily learning to read, but the shift starts to happen where they're reading to learn. And so if your child is behind in these areas, learning is going to be impacted in the other areas, such as science and social studies and math, because on all of those subjects, there's an element of writing. So you may be asking, what is the psychoeducational evaluation, or what is the testing that is normally done, and how do I get there? So if you're hearing again and again over time, like we've had our parent-teacher conferences in the fall, and so you have information from there, you're handing in assignments and you're sharing with your teacher at this point in time that certain subjects are struggles, they're areas of struggle, and it's hard to get the assignments done and they need to be maybe broken down or simplified. This is when your teacher is a great source of information for you, in addition now to your observations, because you are the teacher. But in school, this would be a time to then go to the child study team and write a letter identifying my child needs to be evaluated because I'm suspecting an academic struggle, a learning struggle. It could also be that as a parent, you're noticing that your child may have ADHD, or there's significant anxiety, or there are certain areas of academics where they need more academic instruction, more reinforcement of the instruction. And in those cases, for children who may just need more basic skills instruction, BSI is the next step. But for your child where you and your teacher are on board that this doesn't look like we just need more reinforcement, but rather there's a learning struggle, that's when you go to your child study team, you make a request, and they come back and have a meeting with you. And at that point, they decide if they're going to test. And so at this point in time, because you can't go into the child study team and have an assessment, there's private clinicians like myself and others who provide the psychoeducational evaluation. And the assessment is very similar to what the child study team provides, but the child study team provides it by different members. And in addition, the child study team cannot diagnose, whereas private clinicians can. So this is where you have a little bit of an advantage when you go to your private evaluation, someone who can take all your data, synthesize it, and really take a look at what is that learning profile? Where is my child's learning strengths and weaknesses? How can they compensate for their weaknesses using their strengths? Is there a diagnosis? Is this anxiety? Is this ADHD? Is this a learning disability? What is this? So the psychoeducational evaluation consists of an IQ test, which gives you a full scale IQ as well as 4 index scores. And then there's the achievement test that looks at all the areas of academic functioning And then I personally like to also run some executive functioning testing that looks at learning, attention, memory, cognitive flexibility, impulse control, and so forth. But like the child study team, what I do and what a lot of private clinicians will do is they take the IQ score, the full scale IQ score, and they compare it to the major areas of academic functioning to see if there's a discrepancy. And most schools will use a 23-point discrepancy, anywhere between 1 and 1.5 standard deviations, which is 15 points to 23 points, to look to see if there's a discrepancy. And that's usually a sign that the child is intellectually functioning at a particular level, but academically is functioning at a lower level, suggesting that there is a disability. So when it comes to ADHD, most of the time, your child may or may not get an IEP, an individualized education plan, because that they need a 504 plan, which means they need, not just, but they need accommodations. Whereas an IEP offers your child a special education program and related services such as occupational therapy, physical therapy, speech therapy, and counseling. Anxiety also has a very strong impact on learning, and I've tested children, and parents have said, what is going on? Is it a learning disability? Is it ADHD? And in the end, it's anxiety is really impacting learning, just as ADHD would. And sometimes there's a comorbid diagnosis of a learning disability with ADHD and anxiety, and sometimes there's not. And this is where, it takes a lot of skill in trying to figure out where is the breakdown happening in the learning process, and then how can we create a program for your child in school to give them the supports that they need so that they can go to school and be successful learners and feel good about themselves. Because what happens is then you have children who don't want to go to school and they refuse to go to school. At this point in time, our children who do have a lot of school-based anxiety are experiencing a decrease in that anxiety because the pressure is not there to be there socially and to perform in the classroom. But there's, still the anxiety because the work is there, and you're going to be seeing that. So again, this is not a incredibly comprehensive list, but these are some of the key things to look for that you may be seeing while you're teaching your kids at home, and the different resources that are available to you as a parent in order to advocate for having the supports needed, especially as we're going into the next school year and, going through the summer as well, to find the supports that are going to build up your child's skills as much as possible. Although, like Craig said, the summer slide, that regression in academic skill is very normal during the summer. We're likely going to see a little bit more this year. But the good thing is, I'm going to say it's a good thing, is we're all going to have that summer slide, and we're all a little bit behind, and it's going to be, something that we're going to have to figure out once we see where we are in September. So that's the information that I wanted to present to you, and I'd love to hear your questions and any thoughts you may have about that.
Thank you so much. That was really informative. So I just want to say, as we kind of conclude this portion, and then we'll move to a question and answer, and I have a couple of questions for you, Liz, that, we're all in this together. And, this is uncharted territory that we're dealing with. Dr. Matheis just said that, we're all in this together kind of, and we'll kind of see how we're going to deal with this, because I think that no one really knows what this is going to look like, what the impacts of this is going to be, and how we're going to deal with it. But, the great thing about it is we are all dealing with this. This is not even a United States problem. It's a world problem, right? And, we have some of the brightest minds, looking at trying to figure out how to cure this, vaccines and everything else to kind of help us get through this period. But we also have great minds that we're not really talking about, that are really thinking about how to help our kids get their education back on track. And there's lots of great people trying to figure this out right now. And I'm sure that we're going to have some really concrete strategies, advice, services in place and such to really get people back on track. But just remember that professional help is available right now. And that relates to a question that I have for Liz. Um, so if people are looking for evals right now, what are you offering? What are other people offering? Because there's questions about reliability, validity, and et cetera, and safety and all of that stuff. Could you talk a little bit about
So
that?
yeah, of course. I'm kind of an old school evaluator in a sense in that I don't love virtual. I don't love the computer-based stuff. It sounds, from what I've heard and what I've researched, it's very, I'm going to say cumbersome for lack of a better word. So I am going into the office and really and working with kids to provide the psychoeducational evaluations. So, disinfecting, of course, and you know, using all of those guidelines to keep everybody safe, disinfecting the office and the space and the materials and all of that. But I just don't think I just don't think it's possible from my angle, and I know other people will disagree, is that I really like watching a child approach a task and how they break it down and being able to ask questions in the moment of, how are you doing that? Or what do you think of this task? Or tell me when it started to get harder. Was this easy? And just watching them work through it and being able to, I spend the day with a child or an adolescent or a young adult testing. And we take tons of breaks and we stop for lunch and so forth. But it gives me a chance to see, what does a child look like when they come in the door and in a novel situation, right? And then what happens as the course of the day goes on. And to me, that really mimics what a school day looks like. And I really get so much information, and then I can figure out what does this look like for you? What is your experience as a student in the classroom and so forth? So to answer your question, yes, I am going into the office, and it would be just me and the student, so that there's nobody else, and really keeping everything as sanitized as possible.
Okay. And I think that what people are gonna get is different approaches from different people. It's important to ask about the information about what they're doing, and has this been tested, and is this going to yield the information that I'm looking for, right? Is it going to dilute in any way if I'm changing standardized testing and things like that? The other thing is that some things can be done online very effectively, like therapy. And research, like I said, shows that therapy can be. There's question about psychological testing online, and whether it wasn't studied that way. So obviously we have question about whether it's reliable and valid doing it online versus in person, right? And so the thing is that services are available for people to get good, reliable, solid services, and there's no reason to wait until the fall or beyond to get what your kids may need. It's important that people get the services that they need, whether it be a child study or a psychoeducational evaluation, whether it be therapy, whether it be a psychiatric evaluation, whether it be, as I mentioned, speech therapy, or whatever it happens to be, OT, PT, certain things are going to be harder to do online, right? And, I know that some of these services are opening up in person as well. And I think that each professional is going to make a decision about what makes sense to do in person or in their offices. But just know that, we're all aware, and we're all looking at CDC recommendations and following those so that we can keep everybody as safe as possible.
And if I could just say something, Craig, that the child study teams are available through the summer. So my personal view is that if you are doing this over the summer, as opposed to waiting until the fall, until everybody's going to them in the fall, it's probably, for the parents that I'm working with right now, providing the psychoeducational evaluations, they're going right now to the child study teams. And hopefully they will have everything set up for September if we return, but nonetheless, they will have access then to the programs and the accommodations and the supports that they need come the fall. So that's an important piece to think of too. The other thing that I'm doing is for um, students in high school who need testing being extended, the SATs, and college students who need 504 plans. They're taking my testing and they're bringing it to the ETS board as well as to their, Department of Disability Services or whatever the name is for each university, and they're getting those accommodations. And so for a lot of my college students, they were able to get extended time for their finals and so forth. So I agree with you. Don't wait, because I don't know what more is going to, I don't know what's really going to change. Except that I think the teams are going to be inundated in the fall, would be my guess.
I'm just looking at some of the comments and questions on here. Someone had mentioned that they've done some testing with children through remote for baseline rather than for school purposes, which may make sense so that you can get some type of information in a safe way. So, for as I mentioned, I think different professionals are doing different things. We really are in very new territory. It's always a balance between safety and accuracy and following, standardized methods and those kinds of things. And, we have to make the best decision that we possibly can for ourselves as well as for our clients. And I think that's, what it comes down to. I think that, as the states and the federal government have declared a state of emergency, a number of the different things that had been in place before have kind of been temporarily lifted, and HIPAA being one of them. People are able to do things a bit differently than they had before because some of the restrictions had been lifted during this emergency. So, we may have to improvise a little bit, but it's important to also acknowledge that, we may be compromising some things in doing that. Fortunately, there are some things that can be done pretty much just as well online. And, so for me, I'll just tell you a little bit about my practice. My plan is to be online for as long as I need to really maintain safety, and, I'm not sure what that means in terms of how long. I think there's a lot of questions out there. But if therapy is as effective online as it is in person for most populations, there's no reason to bring people into my office and potentially put them at risk. So for me, it may not make much sense from a therapeutic standpoint, but from a testing standpoint, it might make sense even throughout this whole process to go through and do it in person because it's important to do that. I know there was a question regarding online, playing online with friends, and that, as I mentioned, it is important for children to socially interact. And, at this point, we're kind of limited, as things are getting, as stay-at-home orders and stuff are getting lifted a little bit, we may be able to start to have small group interactions and such, but definitely not at the level that we had before. So this person was asking about video play dates and how much is a healthy amount of time per day. And I think that, my answer would be that similar to what it would be for play dates in general, in person, I would say, online is kind of supplementing for that right now. So I would say, if you usually allow your kids to play with friends for an hour, after school, to continue something like that. Obviously, during the school day, they're not interacting as much, so maybe you might add a little bit of time to that, but essentially, that would seem appropriate. So, I know a lot of kids are playing Fortnite now with each other, and, whereas in the past, we might have been very much about limiting that, quite more than we are now. The important thing is that it's a balance. Once again, do we know the full impact of what that's going to be? No, I don't think anybody does. But it's either your kids are not going to have any social interactions, or they're going to have some. And I think we're erring on the side of the some, and then figuring out the rest from there. The other thing is that social and emotional development is not only something that can be taught between kids interacting. They could be done with adults as well. So play with your kids. Play different types of games where there's turn taking and roles and demonstrating interactions between yourself and a spouse or other kids in the house, so that kids can continue to develop their social skills and be able to express themselves emotionally in an appropriate way, right? So, when they do express themselves emotionally well, tell them how proud you are of them expressing that, so it's really important that we do more, even more than we normally do at home, to reinforce some of these things, because they're not getting that from their teachers. They're not getting that from other peers. So it's important that we try to facilitate as many of those kinds of social interactions as possible, even if it's between child and adult or siblings and the like. So I would say try to
And if
supplement
I
as
can,
much as you can. Mm-hmm.
yeah, if I can add too, doing things that, in the past we didn't really have time to prepare meals together or make dessert together. One thing I share with a lot of parents that I'm working with right now is, give your child chores. And because we are part of a team, and really this is the time to emphasize that everybody needs to take a role, because we're in the house, we're eating a lot of food, and we're home. We're just home, and the house is going to. We can't do this all on our own. So if you were doing it all before, really now's not the time to do it all on your own. Really get your children to take small tasks if they can. Who's responsible for what on what days, and then they can gain reinforcers of whatever it is that your child likes, whether it's, maybe it is more screen time, maybe it is getting, being able to buy something off of Amazon. But I know for myself too, I've seen my children be on their screens, which I understand, like you were saying, Craig, that this is their socialization. Right now they're doing it via screens, which we don't love, but if they're not interacting with their peers via the screen, then there is really very little social interaction. So definitely you want to adjust your expectations a little bit, but then also making time to do things together, eat meals together, prepare meals together, set the table together, have different responsibilities for everybody in the house, no matter how little. Each person can do a little something.
What I also want to do is just say that I have so much respect and admiration for all the parents. I have a 1-year-old at home, and I can appreciate how difficult it is to balance everything, and it's so important for you to take care of yourselves as well. Your kids are important; they are a priority for sure, but it's really important to take care of you. And with that said, I just want to say that I know how incredibly difficult it is to be home all the time, and to have your kids at home all the time, and to have your spouse at home potentially all the time. Um, and you might have a great relationship with everybody, but when you're spending that much time together and without the others in your life that you're used to, it can be very, very trying. So it's important to get, the time for yourselves to take care of yourselves, but also if you need help yourselves, it's important to get that. It could be a very difficult time, especially, with the anxiety and the concerns about health and safety. I'll disclose a little bit more. I lost a cousin to COVID a couple of weeks ago, and it's a really difficult time to lose somebody right now. Besides the fact that, it's horrible to lose somebody at any point. But right now, even the mourning process changes. Even, going to funerals, you can't really do that. Immediate family only, right? And, you're doing this online and virtually. You can't be there to support each other. So there's lots of fear, lots of concern, as things open. It's not less anxiety. Sometimes it's more. I'm sure your kids are kind of ready to go out and do things and have a good time with their friends and everything. And you might have to put on the brakes because you're kind of concerned and you don't know what's going to happen. You don't know if they might get sick. And now we're hearing about kids potentially getting illnesses associated with COVID that we didn't even know about before. So this is a very trying and stressful time. And I just want everybody to know that I've seen a lot of difficulties that people have experienced as a result of different things related to COVID, including, difficulties in the relationships and whatnot. So I just want to say that. And, with that said, I know we're all online, trying to be there for our kids and get our kids resources and things like that. But it's really important that we as adults also recognize that we have needs and that those needs are important as well. And if professional help is needed, get the professional help. If you could use self-help strategies like, meditation, and mindfulness and things like that, go for it. There's wonderful apps out there. We're very fortunate in some ways. Liz, I would imagine you would feel this way too, because we have technology. I mean, can you imagine
Mhm.
that this happened, 30, 40 years ago where the technology was not like it is today? I mean, it would be completely
Oh
different.
my
I mean,
gosh.
we would be experiencing a whole other level of difficulty. So we're very fortunate, that we have so many resources available to us because in the past it would have only been in-person help, right? There would have been no opportunity
Mhm.
for something even like this, like for us to even talk and to you to get feedback and to get help and to have all these professionals providing assistance. So we're very lucky to be living in this time for that reason. And, it's important for us to also, you know, um, also take advantage of the fact that there's a term called post-traumatic growth. And I like to lead people with this. Any trauma that we have, any negative experience that we experience in our life also has some positive things that may come out of it. And it's important for us to look for those as well and to take those positive parts with us. No one's saying we're happy that this happened. No one's saying that it isn't really, really difficult. But we have a tendency as human beings, I think, to focus on the negative and not really think about the good that can come out of things. And, I'm just, urging people to kind of look at some of that.
What a great way to end, Craig, to think about the growth that can come out of this time. I mean, it's hard, like you said, it's not easy. There's definitely moments I'm sure that we're all sitting here thinking, when is this going to be over? When's life going to go back to the way we remember it to be? But we don't know what
I,
it's going to look like,
yeah.
and maybe it'll be better.
I got a really interesting question, and this relates to, some of the things that we were talking about. Many parents will bring their children back to school when they open in August, and many parents believe that COVID is not real or exaggerated. And we don't want to return our child in August, but we are in the minority of parents. Our child will feel excluded or isolated if she's one of the few who will not return. What are our thoughts about that? It's definitely a tricky situation for sure. You as parents have to think about what makes sense for you and what level of comfort um, works for you. If you feel that your child, is not safe to do that, that's important for you to make the decision that's consistent with how you feel. But explaining to your child and having a candid conversation with your child about why you're feeling that way and what's going on and, allowing your child to express their thoughts. I can't stress enough, we tell kids things all the time. We teach kids things all the time, but kids have a lot to teach us as well. And asking your child, how she feels about not going back, what it will be like, and validating that, and being able to allow her to express her feelings about it, and being able to have a real conversation about, what your concerns are, and that you're not making this decision to harm her. You're making a decision for the opposite because you want to keep her safe. So I think it's having real conversations, not hiding that. If you're making that decision, that's going to impact her. It's important for her to have a sense, and I'm not sure how old she is and such, but you would make it obviously age appropriate, right? And you would ask what she knows and what she knows about COVID and how COVID affects people and all of that stuff, and then you would express, what your worries are and concerns about are, and that you're actually going above and beyond to keep her safe. You know, Liz, do you have any other thoughts about that?
Going back to school in September.
Well, about how to even talk to your child about it. If you decide, not to go with the opening, or it could be anything. It doesn't have to be school even, right? The public, the pools are opening, the local community pools are opening, and maybe some parents don't feel comfortable, and kids are like dying to go to the pool, right? They haven't been out this whole time. They want to enjoy the pool, and parents are like, no, we can't go to the pool. There's a million people there. We're not going to social distance there.
Right. I mean, you're the parent, you're in charge. That's a decision that you make, for your family, and you hear what they have to say. And like you said, you validate, and you find ways that feel comfortable to you as a parent. How are you going to let your child socialize or go out into the world in a way that still feels comfortable and safe for you? And that's, there's going to be so many different ways of thinking about this. And there are people all over the spectrum who are like, let's go to the pool. And some people are like, we're not leaving the house. And we're still going to have everything delivered to the house because we're not even leaving. So, and then all the space in between. So they're going to be frustrated or they may be okay. It depends. If your child is old enough and understands your rationale and is okay with with whatever you are allowing, then you can be okay. I found that it really goes in all directions. Children who are like okay with what their family decides, and then children who are rolling their eyes out of their sockets. So,
And we just have no idea. We don't have no idea if we're making the right decisions, what the decision should be. I mean, all of that is to be determined. And, you could be saying now, well, maybe I'm being too strict about these things, but you may be making the complete right decision and everybody else is making a decision they're making the best decision they possibly can. I'm not in any way saying that people are, purposely, making bad decisions, but, we can only do what we know with what information we have in front of us. Hindsight's 2020. I wish all of us could go, into 2 years from now and kind of see what happens and then make the best decisions based on that. But unfortunately, we can't. And so we do the best we can and hope for the best. And, that's all we can do.
and
But
there's
know
no
that,
right or wrong.
right, there's no right or wrong. And you're not alone in that decision either. As Dr. Matheis said, you're totally with a whole bunch of other people that feel the same way you do. It may feel like you're the only one or your kid's the only one being held back. I can guarantee that that's not the case. There's a whole range of concerns and feelings about this. It's so interesting and this is something that I've talked to people about and thought about, but some of the things that we used to think were disorders or difficulties that people were having are the norm now, right? If you used to see people walk down a street and avoid other people, you'd be like, what's wrong with that person? But now if you don't do that, something's wrong with you, right? We're going at this. We have no idea. This is all new stuff for us. Even as mental health professionals, we're trying to make sense out of all this because some of the diagnosable things that we would diagnose before, now we can't diagnose anymore because they're the norm, right? And now we have to wonder if people don't do that, now might have to diagnose, right? So it's very hard and very tricky, but we'll all get through this. And that's the end. That's the end, kind of real end to this, is that we're going to get through this. We don't know exactly how it's going to look. We don't know when. We've gotten through lots of other things in our lives, and this country has gotten through a lot, and the world has gotten through a lot, and we'll get through this as well. Just know that's on the horizon. Unfortunately, I wish I could say, well, we'll get through this within the next 6 months. We just don't know that, but we will get through this. I'm very confident of that. So we want to thank everybody for coming tonight. It was wonderful questions that we heard from people, comments. So many people said that this was helpful to them. That's what we wanted. We wanted this to be a helpful thing. We're both available if people have questions. We're going to send out a audio. I mentioned this when I typed it in. We're going to send an audio with a brief summary of some of the things that we talked about today to everyone that registered, including the people obviously that attended. You'll have that, and our contact information will be on there as well. So if anybody wants to reach out for the work that I do, I offer everyone a 15 or 20-minute free consultation so that you could talk about the issues, whether I'm a good fit or not. I always make recommendations for others if I'm not a good fit. If you're looking for therapeutic help, if you just have some questions, you can definitely reach out, and I'll be happy to answer any questions that you have. And Dr. Matheis, I'm sure would do the same. So feel free to reach out, but there's help out there, so you're not alone.
Not at all. Thank you, everyone, and thank you, Craig, for having me.
Sure. Take care, everyone.
Good night, everyone.